This is one of our new affiliate talks, and I'm very pleased to introduce Jooyoung, who will be talking to us about her work with the Wisconsin Longitudinal Study related to violence across generations. She said that she's happy to take questions of clarification, but requests that you hold substantive questions till the end.
Yeah.
And I will let her take it away. Thanks, Jooyoung.
Hello, everyone. Thanks so much for coming today. My name is Jooyoung. Again, I'm an assistant professor at the Sandra Rosenbaum School of Social Work. Again, I'm delighted to be here, and I'm excited about being a member of the IRP as an affiliate. I'm a gerontologist. I've been studying the long-term effects of childhood adversity on later life outcomes. And I just want to say that I just started incorporating the issue of poverty into my core research topic. And I really hope to expand this collaboration of these topics to advance my research further. So today's presentation will reflect where I am now in terms of this effort. I will mainly talk about two of my papers that's recently published. First one is it's related to my primary research, looking at adults with a history of childhood maltreatment and their later life relationship with their abusive parent, is particularly in the context of family caregiving. So it was a way to introduce the research that I've been focusing on so far. And the second paper is related to the more poverty-related issue, I would say. It's kind of an extension of what I've been doing so far. And so it has intergenerational piece about parents were abused or neglected in the past, and what's the effects of living with their aging parents. So that has that intergenerational piece, but then I used data from the Wisconsin Families Study, where Dr. Christy Slack is PI'd on, and the majority of the sample were racially, ethnically diverse, and with low socioeconomic status. So I'm very excited to share my findings so far. So when I introduce my research, I usually start with this image. The circles in the bottom represent how individuals develop or grow across the life course from early childhood to late adulthood. I wonder if you can guess what the tree represents. The tree represents the family of origin, the origin of who you are, and one of the most important social group that can support your positive development over time. And the highlight of this image is this long reach of the tree, which signifies that the relationship with the family of origin usually expands up until later in adulthood, and people generally gain support and comfort from the close relation with their parents or their siblings. But I want to point out that not everyone has caring and nourishing relationship with the family they grew up with. As you might well aware of the high prevalence rate of childhood maltreatment, that annually 10 out of 1,000 US children are victimized by their parents. And now we know very well that childhood maltreatment can negatively affect individual health and well-being in later life, and it can have negative impact on the quality of relationship with your spouse or partner, or even relationship with your offspring by undermining the parenting capacity, and even some perpetuating violence against their child, which we will see in the second paper. But I wanted to point out that this long reach part of the tree, that especially later adulthood, right? How these adults who experienced abuse and neglect in the past, and now they become an adult, and how they're gonna relate to their aging parents who used to be abusive and neglectful to them. So when I started this research, there was literally nothing around this issue, how these adults with a history of childhood maltreatment relate to their parents. So I was excited about finding out this huge gap in the literature, but then I was also surprised by how little research is out there. Because at least to me, this seems to be an important issue. It's about parent-child relationship, and it's also relevant to current context and aging society where people live longer and they share longer lives together across generation. And so I thought it may not be an exception for adults with a history of childhood abuse that they continue relate to their parents, or some even stepped up and providing care to their aging parents. So that was very rough introduction of my research so far. And to better understand the effects of childhood maltreatment on adult intergenerational relationships, I considered how existing theories inform these complex relationships. So the broader theoretical framework is the life course perspective that underscores the linkage between childhood experiences and outcomes in later life. And one of the core principles of the course perspective is the linked lives principles that people typically tangled up in social relationship with their kin and friends across the life course. Convoy model is in line with this linked lives principle that individuals move through life surrounded by a group of close and important others who are often family members, and they are meant to protect and support these individuals. So the quality of the relationship with your parent or characteristics of your relationship with family members, it affects your health and well-being. Intergenerational solidarity theory offers some additional explanation. So according to this theory, solidarity across generation, it's not a single dimension, but it consists of multiple aspects, which include contact frequency. How often do you contact with your parents? The emotional closeness with the parents, or exchange of social support, or the strength of the filial obligation. So there are 6 different dimensions. And according to this theory, if you have strong elements of this relationship, it will enhance your health and well-being. And so based on these 3 existing theories, I came up with 3 speculations. First, adults with a history of childhood maltreatment may continue their relationship with their aging parents, and there might be a persistent negative effects of past parent-child relationship on later life relationship with the parent, and this persistent negative effects of the relationship. So the currently having reduced solidarity with their parents may negatively affect their health and well-being. In addition to this review of the theories, I also reviewed the prior studies related to what are the long-term effects of childhood maltreatment. And I also reviewed literature in the family caregiving and came up with this, my own conceptual model. So I hypothesized that history of childhood maltreatment would negatively affect caregivers' health and well-being. Part of it is related to long-term correlates of childhood maltreatment, like low self-esteem or lack of social support, like coping strategies, like maladaptive coping strategies. All these outcomes are related to these childhood maltreatment histories. And so I hypothesize that this aspect may moderate or mediate the association between childhood maltreatment and caregiver health and well-being. I also consider this piece about current relationship quality or ongoing relationship quality. The history of childhood maltreatment would negatively affect current relationship with the parent, and that may increase caregivers' negative health and well-being. And so I used to test this hypothesis. So I often heard that I'm quite brave. I think that means I'm examining this complex, associations using quantitative approach. But thankfully, there were 2 national surveys that included both self-reports of retrospective measures of childhood maltreatment and their current status of providing care to their parents. And so I was very lucky to use these 2 national data sets. I will pinpoint some limitations of these data. One of the critical limitations is that majority of the sample were white. So it's a story about white people with those who have at least high school education. And they tend to have high income group. So I just wanted to point out these limited characteristics of these samples and then share the findings of the first paper. So this paper was most recently published and then tested. I've been testing this bits of relationship and that bits of relationship in the conceptual model. But in this paper, I was able to test the whole model because I know about the data better, and so I was able to test the whole the conceptual frameworks. And so the idea was that the key independent variable, parental childhood abuse, and how does that relate to depressive symptoms of caregivers. I looked at the the mediators as frequency of contact and perceived closeness. And then I wanted to look at how the aspects of long-term correlates of childhood abuse, like self-acceptance and environmental mastery, may affect this mediational dynamic. So I ran the moderated mediational model. I will be more specific about the measures and so forth. And so the study hypothesis was that histories of childhood abuse would be associated with greater depressive symptoms in caregivers through reduced contact frequency and emotional closeness with perpetuating parent. And then I examined whether their psychosocial resources would moderate this mediational association. So I was expected that psychological resources of care, so mediating effects would be stronger. The mediating effect would be stronger for those with the lowest level of self-acceptance and mastery. So to test our hypothesis, I used the longitudinal data from Wisconsin longitudinal study. I'm sure many of you are familiar with this data set. It's a long-term study of random sample of about 10,000 high school graduates in 1957. So their ages their average age is homogeneous. They have same age since they are the high school graduates, and also selected siblings. They were longitudinally surveyed. These graduates and siblings were longitudinally surveyed. And I mainly used the first 2 waves because in the third wave, when graduates reached their mid-70s, very few parents were alive by that time. So I was focusing on the first 2 waves. And so the study sample was adult children who provided care to their parents at wave 2. I divided the sample into two groups, caregivers of mothers and caregivers of fathers, mainly to assess what's the mental health effects of providing care to the perpetuating parent. Right, so I divided into two groups. Majority were female, married, and their average age was 65 years old, and they reported very good health status on average. So measures, the key independent variable were maternal verbal physical abuse and paternal verbal physical abuse. I ran the factor analysis and concluded that it's better with mothers of use together and fathers of use together. And I make sure to include both of these abuse in the model. And the dependent variable was depressive symptoms. Mediators were, again, the frequency of contact and perceived closeness. They are based on single item measure. And I wanted to point out that they are from the previous wave. There were several reasons, but first of all, for the rigor of this mediation model, I wanted to have some temporal order among these variables. So we have, although it's retrospective, we have childhood measures as an independent variable, and we have mediator from the previous wave, so that make sure it's not affected by their current caregiving, and then caregivers' depressive symptoms at wave 2. And then I combined Reeves measure scales of self-acceptance and environmental mastery, mainly because they were highly correlated, and so I combined and put it as one variable. Okay, I will share the key results, and I make sure added these controls in this moderated mediation model. Yeah.
Can you tell us how caregiving is defined, like how people get into the caregiver group in this sample?
So do you mean how did I define the caregivers, or?
But, how, I assume you're using some variables from the WLS.
Yes, yes. Yes, that's very important questions, and it also related to limitation of this research. So the caregivers were self-identified. So the question was, has respondent ever given personal care for a period of 1 month or more to a family member or friend? And then they identify whether they provide care to their mother or they provide care to their father. Yeah, and then I will talk about it later on. I did sensitivity analysis, narrowing this this definition of caregiver to those who provided care to in the last 12 months. And I found the consistent results. But I did not use that as a main analysis because there was a small sample size. I had to pull caregivers together from different waves, and so this was the main analysis. Yeah. So it asked, have you ever given care to your mother or father? Thank you so much for the question. Yeah. They did not specify that. They did not specify that. But then, considering the characteristics of these study samples, I assume many of them are biological parents. Yeah. Any other clarifying question? Okay. Feel free to ask me a question. Okay. So I think I've done all the way. Right. And so I estimated the mediation model and the moderated mediation model using M+ software. And I used missing data were dealt with full information, maximum likelihood approach. So this is the model for the mediation analysis. And this is an example of caregivers' mothers. As I shared, there were two group caregivers of mothers and caregivers of father. I included, in both model, I included two independent variable, maternal childhood abuse, paternal childhood abuse, and two mediator specific to the relationship with the care recipient, and then assessed depressive symptoms of caregivers. The result showed that in the caregivers of mothers group, maternal childhood abuse was negatively associated with emotional closeness with mothers and the contact frequency with mothers. And I found significant indirect effects where maternal childhood abuse was associated with lower levels of emotional closeness with mothers, which was in turn associated with higher depressive symptoms of caregivers of mothers. In the caregivers of fathers group, paternal childhood abuse was negatively associated with emotional closeness with father, contact frequency with fathers. However, I did not find a significant indirect effects. I conducted other supplementary analysis, estimated this model among non-caregivers, estimated the same model among caregivers of other family member, not parents, other family member or friends. And I did not find a significant indirect effect. This significant indirect effect was specific to caregivers of mothers. And then once I identified this significant mediational path, I added interaction terms between perceived closeness with mothers and psychological resources predicting depressive symptoms of caregivers. I also included interaction terms between maternal childhood abuse and psychological resources predicting depressive symptoms. The result, I found, as you can see the red, the asterisks, the maternal childhood abuse, there was significant indirect effect, significant interaction effects of maternal childhood abuse and psychological resources on depressive symptoms, which means the negative effects of childhood maltreatment on depressive symptoms was higher among those with lower level of psychological resources. But I did not find the significant moderated mediation effects, which means that this mediational effect did not differ by caregivers' psychological resources. And so this is simply reiterating what I just mentioned. I found one significant interaction effects, but the mediational path did not differ by caregivers' level of psychological resources. Okay, and so despite childhood maltreatment, relationship remain and some provide care. So this is a statement related to my other research, not specific to this one. I found that depending on the data source, 15 to 40% of parental caregivers were reported a history of abuse and neglect. Emotional closeness as a significant mediator. So what would that mean, right? And so this is consistent with the caregiving literature, where what really matters for caregivers' health and well-being is it's their relationship with the care recipient. There's one body of literature arguing that. It's about your relationship with the parents. And that's related to reduce or increase the harmful effects of caregiving on your health. So this result is kind of in line with those research. And what else? Yeah, kind of lost. Yeah, and this is also in line with intergenerational solidarity theory, and this affectual assessment, it is affectual solidarity with the parent that was most important. I would say one of the most important aspects in terms of the intergenerational solidarity, and that that is known to increase psychological well-being of adult children. It also affects reducing some conflicts in the relationship, or it also, as I said, reducing some negative effects of family caregiving. And so it's also in line with these prior studies. I also wanted to point out that why mothers, right? Not father. Why is that? And so part of it might be related to that. For many of these study samples, mothers would have been the primary caregiver when they were growing up. And so we know from the attachment theory that your relationship with mothers matters for everything. But then I will also correct that your caregivers, but it may have long-term effects even in late adulthood. That's one thing for sure. And also prior studies talking about this mother-daughter relationships. And since majority of the caregivers were female, it may be related to this mother-daughter dynamic where they share rather intense, emotionally intense relationships in a good or bad ways, especially one is dependent on the other. And these results, I want to point out, remind me of this concept of cumulative. Yes.
Going back to your last point on the relationship with Asian mothers versus Asian fathers.
Yeah.
The fact that you've been originally trying to look at the results for the Asian father group. I was wondering if part of that is the fact that women tend to live longer than men, so they're more likely to have caregiving needs in the first place.
Yeah.
And then second of all, the fact that mothers tend to be the caregiving recipient in later age as opposed to fathers receiving caregiving.
Yes. Yeah.
We're able to account for that as well.
So in another sensitive analysis, I added several other caregiving context variables, but then I wasn't able to run that model with caregivers of fathers. Like you said, there were very few samples. They died earlier, fathers died earlier. So I haven't been able to control for all these caregiving context characteristics and variables. But those are really important point I think I wanted to address in the near future. Thanks so much for the comment. Okay. Right. So what I mean by cumulative disadvantage, so the idea is that the disadvantage you experience in childhood, it kind of accumulates over time. And so late adulthood is when all these disadvantages proliferate and widen this disparity in terms of later life outcomes. And so I see this way, like they had challenging relationship with their parents during childhood, and they have that legacy of dealing with all these correlates of childhood maltreatment, right? Use of emotion-focused coping, or this reduced psychological resources, and having reduced cohesion with their parents. And all this play a role and lead these caregivers having increased depressive symptoms. So that's just the idea that I wanted to share. All right. Wanted to point out the limitation of the study before moving on. So used retrospective self-reports of childhood maltreatment that may involve recall errors, and then the scope of childhood maltreatment was limited. It mainly asked about frequency of your experience, so it did not assess intensity of the abuse, or limited in terms of measuring the intensity of the abuse or the chronicity of the abuse. Again, lack of diversity in the study sample, so the results may quite differ when this model is applied among racial or ethnic minorities. And I wanted to point out quantitative research approach. It has multiple layers. This topic has multiple layers and complicated relationship across the life course. I'm bridging childhood and later life experience And so quantitative research approach is limited in terms of addressing what happened in between times. So I really wish to delve into the qualitative research where I will better reflect their experience, their voices, and also that can inform that more hypothesis to test. So that was my research about me doing so far. Yes.
I was just wondering if you have any information on whether the parent that was abusive had also been abused, and if you had any information on whether they were an alcoholic, because you could imagine that, like, the way that an abused child would sort of, their relationship with their parent might evolve differently if, like, the abuse was stemming from sort of
I see.
an alcoholic parent versus a parent that
Yeah.
wasn't regardless.
Yeah.
I'm just curious if
Yeah.
that's information you have.
So the first part was about whether these caregivers become abusive to their parents, or No.
I guess I was wondering if you would have, you may not have this information, but if the child who was abused by a parent, if that parent had been abused. So, like,
oh,
and because I'm thinking that, like,
Yeah.
maybe the way that you see
Yeah.
an abusive parent is different if you know that they also have
yeah. Based on the intergenerational, the transmission of violence hypothesis that I will be talking about, it's very likely, right? I have not been able to access that information, but I guess it's very likely, and I will share what I mean by intergenerational transmission of violence. But then it added more complexity into this dynamic. It's a cycle of abuse across generation, and that's ongoing. And so, yes. And the second question, sorry, so the alcoholic part. So based on some anecdotal narrations or some qualitative comments from the media and so on, even though they were not mental abusive, they have other reasons of alcohol abuse and so on, but they still feel really harmed and neglected and so on. And so, and my hypothesis is that it will complicate the situation even more because of the ambivalent feelings about their parents, right? They hate their parents, but they kind of know the reasons why, and it complicates this. That can be a source of ambivalent feeling they may feel towards their parents, and the existing literature shows that these ambivalent feelings are very bad for their individual health. So yeah, that's what I can say for now based on what I know. Yes.
I was wondering if you can observe the reason for caregiving. I guess the reason why I'm asking is because I can imagine that if the parent has some kind of dementia or other like conditions that affect their cognitive ability,
Yeah.
or some physical condition, it might
Yeah.
the relationship between the parent and the
Yeah, so my doctoral students are doing qualitative interview, and that's one of her questions. But in the national survey of parental caregivers, more than half of them were saying, I had no other choice but to provide care. So my speculation is that it's maybe the case for these caregivers, that if their parents go through like terminal illness or end of life care, they have no other choice to step in, or based on the cumulative disadvantage hypothesis. Although I tested hypothesis among high income group, if they are in low socioeconomic status and they are not able to afford the long-term care options, but then they had to again step in to the caregiving, and then they have to go through all this. And so I have not been able to look at the reasons why, but I speculate there must be very different reasons. And I also wanted to point out that some based on the anecdotal narrations or qualitative messages, many of them were like, this is my obligation. No matter what happened, they're my parents, so I step in. So there are many people like that, and they, based on limited qualitative notes, they were like, it was a chance for them to like forgive their parents, and it was like a resilient experience for some of the caregivers. But I don't think it will be the pervasive experience for these caregivers. Yeah.
If you've ever thought of, or in your process had thought of thinking about variables other than depressive symptoms, health and wellness variables to see
Yeah.
if it manifests differently?
Yeah. I've been mainly looked at the psychological outcomes. So when I tested psychological well-being, I did not find the association. But when I looked at not caregiver, but overall adult children, right? Overall adult children, they showed lower level of emotional closeness with their mom, and then they showed not depressive symptom, but lower level of psychological well-being, which is consistent with intergenerational solidarity theory. It was more like their well-being. I have tried physical health outcomes. I did not find many significant outcomes, but I think it was kind of symptomatic, psychosomatic symptoms type of. It's also psychological, right? Yeah, so I wish I proposed a grant proposal where I wanted to look at biomarkers associated with this caregiving stress, and I wish to, I will see what's gonna come out. So yeah, that's where I am. Okay, so this second paper is, again, extension of my research that I shared, because they looked at the study respondents' histories of childhood abuse and neglect. And some of them are living with their parents, which we assume to include an abusive parent. But then the key difference is that I used the Wisconsin family study, where the majority of samples were racial and ethnic minorities. They have low socioeconomic status. So the study respondents they gained attention of CPS. So they are reported to CPS, but after the investigation, the case was closed. So these data are very specific characteristics of the study sample, which I will share. So I will briefly share the intergeneration transmission of violence. So it's based on several theoretical foundations, including social learning theory. So social learning theory of aggression is that children whose parents use aggression to problem solve tend to show aggressive interpersonal behavior based on their observation of the parents. So their use of this aggressive interpersonal behavior is reinforced through approval or even reward over time. And so using aggression is like an acceptable or effective means of conflict resolution. And so the idea is that those who were abused and neglected in the past, they may adopt violent behavior toward their own children. And so there are empirical evidence support the long-term effects of childhood maltreatment on engaging in harmful, maltreating parenting practices. And studies also show that the socioeconomic disadvantage as an added stressor. These parents with low socioeconomic status showed higher risk of perpetuating violent behavior toward their children. And so this cycle of violence increased with the stress associated with lack of financial resources or low socioeconomic status. In terms of whether living in 3gen household, is it is it a source of social support or stress? There are mixed findings. Some say living with grandparents, or parents, their aging parents, living with them, can improve the positive parenting behavior, like they have more structure or rules in the family routine, or studies have shown that living in three-gen household can increase parents' mental wellness, and that can improve the interaction with the parents' offspring, right? But then there is also study findings that living in three-gen household could be a stressor if parents has to involve with the caregiving obligation toward the aging parents, or again, this mother-grandmother conflicts, when in that case, living in three-gen household would be a stressor. So when I approached this research, I was more leaning toward, so in the context of intergenerational transmission of violence, I was leaning toward, so living in three-gen household, right? Living with their aging parents would be a stressor, because based on my research that childhood maltreatment affects some lower level of emotional closeness with their moms at least, and so that may increase conflicts, ongoing tension, and so, okay, this might be a stress for these parents, so these parents will engage in more abusive or neglectful behavior toward their kids. So that was how I was processed that. But I also cannot rule out the possibility that, especially if they are financially in needs, they may gain support from these aging parents, right? And so I tested this hypothesis. So the first hypothesis was that childhood exposure to violence would associated with greater abusive and neglectful parenting behaviors. So I looked at study respondents, their retrospective reports of experiencing violence from their parents and how they engage in their parenting behaviors. And then the second hypothesis, I did not specify the direction of the association. My hypothesis was that it will moderate at least. Yes. Do you have a question?
I'm just wondering, you talk about a lot of the characteristics of living in the couple, but why are they getting together in the first place? What their characteristics are?
Yeah, we'll see. Part of my results may address your question. So it's a spoiler alert. I will share later on. Hold that thoughts for a moment. Why would that be? And I will share the prevalence, right? Percentage of people living together. I used the Wisconsin Family Study that surveyed parents living in Milwaukee County in Wisconsin. And study was conducted in 2016. And these parents came to the attention of Child Protective Services, but they are not ultimately served after investigating the maltreatment report. So these parents are showed high risk of childhood maltreatment. And they also participants of evaluation Project GAIN. This Project GAIN is a program to enhance parenting, targeting these parents, and reduce the risk of child maltreatment by assisting these families with mainly economic support. So they provided some counseling, or they provided one-time emergency cash assistance. So the final study sample included about 700 respondents who provided usable data in the first wave of the Wisconsin Family Studies. And 94% female. They were young, 34 years old on average. More than half of them were non-Hispanic Black, 24% non-Hispanic white. and 60% reported that they had their youngest child is 5 years old or younger, and they obtained high school diploma on average, and their average total income, household income, was less than $30,000. So it's almost like opposite of the study respondents that I've been used. The dependent variables were, again, these parents' use of abusive, neglectful parenting behavior, including psychological aggression, physical aggression, or neglectful parenting. The range was 1 to 5, and there were multiple questions for each of these dimensions, and I averaged them. 1 was never, 5 was very often, and you will see that on average, they reported they rarely used these parenting behaviors. Independent variables were these parents' histories of childhood maltreatment. There were multiple questions for their own experience of abuse and neglect, ranging from 1 to 5, and witnessing domestic violence. About 50% reported witnessing domestic violence, and I was like, wow, it was more than 3 or 4 times than the prevalence of this percentage from the national surveys. So I could tell that these parents experienced, several ACEs, adverse childhood experiences.
So, that variable, witnessing domestic violence, what's the set of things you should have in mind?
Do you mean what was the question? Would it be helpful to share the, it was a binary item. Yes, it was a binary item. Ask whether respondents' parents or adults in your home ever slapped, hit, beat, kicked, physically hurt each other.
Okay.
So
it had to do with when they were children.
It was when they were children, yeah. So the independent variables were all the experience they had as a child. Dependent variables were their current parenting behavior. And living in 3-gen household, 12% reported living with their parents, 2% lived with their fathers, 7.7% lived with their mothers, and another 2.3% lived with both parents. I will share the limitation of this, but the independent variable, their history of childhood abuse, did not ask from whom they got abused and neglected. So for us, it was unable to assess whether they currently live with the abusive parent or non-abusive parent. So that's a limitation of this research that I wanted to point out. I included a set of controls based on the review of literature. So I ran several OLS models. So first model, I included independent variable with covariates, and then I added interaction term between childhood exposure to violence and living in 3-gen household. Survey rate was applied, and it was also a unique experience that these independent variables were highly correlated. I did not have that issue with other data sets, and so I had to run separate models for each of the independent variable, and complete data were provided by 91% of respondents. With the 10% cut, I didn't do multiple imputation, but with a few control variable, like total household income had some missingness, so we mean imputed for those items only. Right, I will share the results. So childhood abuse, neglect, witnessing domestic violence was associated with greater use of psychological aggression towards their kids. I found that living in 3-gen household reduced this risk. I found in terms of witnessing domestic violence and living in 3-gen, and And then the interaction term between childhood abuse and living in 3Zen was marginally significant. But considering this small sample size, I see this as a power issue. So you see the direction is all negative, which means the negative effects of childhood maltreatment on use of these maltreating, the psychological aggression is reduced. There's a protective effect. In terms of physical aggression, I found consistent results. History of abuse, neglect, witnessing domestic violence was associated with greater use of physical aggression towards our kids. I found that only marginally significant in terms of the witnessing domestic violence and living in 3Zen, but the direction was also consistent. In terms of neglectful parenting, I found the consistent results. Histories of abuse, neglect, and witnessing domestic violence was associated with increasing neglectful parenting. Neglectful parenting was more asked about these parents were not able to meet their kids' basic needs, nutrition, clothing, healthcare. And I found also two of these associated protective effects in terms of childhood abuse and living in 3Zen, neglect and living in 3Zen. I want to point out that the neglect and living in 3Zen were only marginally significant, but you will see the direction of these interaction effects was consistent throughout. So to sum up, parents' history of maltreatment associated with greater use of abusive, neglectful parenting behaviors, living in 3Zen household reduced the effects of childhood violence exposure on maltreating behavior. And I will talk more about what's in the parentheses. So I talked about whether living in 3Zen household, is it a source of support or stress? Based on that context, I may conclude that they may serve as source of social support. So back to your question, they may live together to share resources together. This may be a way to get support. Even that could include their abusive parent, it may be their choice to share resources and address their unmet needs. To further check with whether they living in 3Zen is a source of support, I checked that I ran some post hoc analysis, and I found that respondents living in 3Zen household, they use less paid childcare than those who are not living with their parents. And this association was stronger for single parents who may have greater needs for childcare and others. I also found that for respondents living in 3Zen household, their youngest children tend to be younger than those who are not living with their parents. So this is kind of leading to they may get some support with the childcare, or they share, again, resources with that. And so to further look at that, I ran 3-way interaction models, including adding this single parent status into this interaction model that I shared to see single parent who may have greater needs. Would there be further protective effects, right? So I wanted to test that. Would there be further protective effects? And I found that in terms of predicting neglectful parenting behaviors, the protective effect was more pronounced among single parents. So this is higher, they had high level of childhood abuse. For most other group, it increased the use of neglectful behavior. But for this group, living in 3Zen and single parents, the reduce was decreased. And so it may not be a perfect way to support this, but it kind of shows that okay, why they live maybe together, and is there a source of support or stress? This may support that the idea of living in 3gen could be a source of support for these parents. Right, so limitations wanted to share. So the key variables were based on self-reported retrospective measure, but some sensitive questions were asked through the computer-assisted interviewing. I believe that was related to dependent variable, but still it has some recall errors or social desirability bias. And as I mentioned before, childhood abuse measure did not specify which parent they experienced abuse and neglect, and so it wasn't impossible for us to assess whether they live with abusive parent, non-abusive parent, and the speculation is that there might be a potential selection bias that they decide to live with their aging parent who's less abusive or non-abusive. Limited generalizability related to this very high-risk group of families who reported to CPS, although the case is closed. And so, yes, it limits generalizability of the study findings. So putting all things together, our finding supports the intergenerational transmission of violence hypothesis and protective role of living in 3gen household. But more research is needed in under what context and what factors might associated with beneficial or harmful effects with living in multi-generational households. For example, based on our results, we did not find protective role in terms of reducing physically aggressive parenting behaviors. It was only related to verbal abuse or neglectful parenting behavior. And so part of it is that their grandparents may use, or their parents may both use these physical aggressive parenting behaviors, or just living together may reduce some a verbal aggression or neglectful parenting behavior, but not necessarily physically aggressive parenting behavior. So again, more needs to be done to provide better understanding about this context. And I wanted to point out that it may be helpful for these parents to diversify their resources, source of support and resources. It may be possible that these parents are one of very few support they can receive. And so they may live with their aging parents despite what happened in the past. So diversifying and widening their source of support may prevent potential conflicts between parents and grandparents. Based on my research, that relationship could be hard. And combining first and second paper together, I want to point out that this research about adult relationship between grown children with history of childhood abuse, maltreatment, and their parents, there aren't much research out there. And so more needs to be done. And I wanted to point out that comparing the results from the two studies, I think the effects of maltreatment on adult intergenerational relationship may depend on where these adult children are in terms of their life stage. Are they caregiving their young kids, or they are in their midlife and they have to provide care to their parents? So where they are in terms of their life stages, which is related to the role dynamic, right? Who is dependent on whom, right? That may have implications about the quality of the experience or outcomes between these adult children and their parents. very cliche, but wanted to say that more research is needed, right? Because none just started, this research is just started. And so especially I wanted to look at this intergenerational relationship based on cumulative disadvantage idea, is that maybe the relationship with the family of origin, it's the source of disadvantage throughout the life course, right? They have to deal with these parents in different life stages. And so, and as you looked at in the first paper, I control for childhood SES and adulthood SES to test the model. Opposite thing I have to do, I have to look at what's the effects of low SES or poverty, and how does that change the dynamic between these adults and their aging parents. And so that's I wanted to point out. Okay, thank you so much for your attention. I'll be happy to address your question if you have.
Is it not possible to use the PSID for this because the PSID doesn't have questions on child nutrition? That's the issue. Because that'd be a natural data set otherwise for this purpose.
It would be amazing for me, but I'll find out. I will find out if it.
I'm not sure that it does.
I don't remember.
Yeah.
what they use in the-
I don't think so. At least not in the early reads. That's the question, is whether that has stuff there.
Yeah. Okay.
It's worth checking though.
And then, yep.
I was wondering for the second study where, so it's self-reports of the parents abusing their children, right?
Yeah.
I was wondering if you had any information from the initial reports to CPS, and whether you could see, like, are the self-reports kind of reliable in terms of, at least among this sample,
Yeah,
the
yeah.
severity of at least what was reported to CPS? Like, if there's anything in the data about kind of what was initially reported.
Yeah, like if there's any discrepancy, right? I don't think, I will ask to Dr. Christy Slag about that, but that's fascinating idea, because they tend to less report of their maltreating parenting behavior, but then which means our findings are more conservative, right? So yeah, I will see if there's any ways to check between those two. Thank you.
You're thinking about whether intergenerational households are supportive or stressful.
Yeah.
Is it typical in the literature to see that as like a dichotomous thing? Because I would imagine that it's both at different times for different reasons.
Yeah.
Supportive and stressful, and maybe there's a negotiation of trade-offs that people are thinking about.
Yeah.
Whether they're going to make, is it going to be worthwhile? I need
Yeah.
to live with my child. I'm willing to live with my
Yeah.
parent who I don't really like, but I know I can sort of trust, or whatever,
Yeah.
that is trade-offs more than just a yes or no.
Yeah, I completely agree with that. That's why part of my implication of the study, even if I kind of concluded that it's a support, but I also argue that the support has to be diversified, because there could be potential conflicts from this dynamics. And so, yeah, I agree with that.
There's whether or not that's like a measure or a set of measures that have
More
more
nuanced.
nuance than one or the other.
Yeah. Well, what would be a way to measure that, right?
That's a great question.
Yeah. Maybe we might have to directly ask them about their experience. Yes. Thank you. Yeah.
Also about your first paper,
Yeah.
with other pregnancy when adults who were abused as a child, whether they were less likely or more likely to be a caregiver to the abusive parent.
I have not been able to look at that. And speculate that it's less likely, but based on very few qualitative interviews, these abused adult children step in the caregiving role despite there's other siblings who've never been abused from the parents. And I wonder why. And so, yeah, I do not have that information now. Again, another research that I want to pursue. Yeah. Thank you. Yes, I will go with that and then.
So it seems like your conclusions in the second paper would be a lot stronger if you could, and I'm going to suggest something that
Yes,
that
please.
is not necessarily easy to do. If you could find an instrumental variable that would help you predict 3-gen household participation. I mean, the endogeneity between having experienced child nutritional treatment and the likelihood of wanting to move in with those parents seems like so problematic. But if there's some, if there's any, and I don't have any great suggestion off the top of my head, any way to think of an instrumental variable that would help predict living in a 3-generation family separate from those child welfare issues.
Yes.
That would help, I think, a lot in sort of making the conclusions more convincing.
Thank you. Thank you for that. Yeah.
Do you have any information on whether they moved in together with a parent because they needed to take care of the parent, or whether they lived together with this parent their whole?
No information, no variable related to that. Yeah.
How far you are from your parents?
How far they are? I don't think so. It was just who do you live with, and they listed the people they live with. So we use that variable for this paper. Yeah. Yes, please.
In the logic model in the first paper, you had an arrow from paternal child maltreatment to the quality of the relationship with your mom.
Yeah.
But I don't think you told us about that.
Which one?
So if the dad misbehaves, does that affect your relationship with your mom when you're an adult?
Yeah. And so you were talking about the non-abusive parent. How does that relate it to?
Yeah.
Yeah. So if you're abused by your mom, what's your relationship with your dad?
Yeah.
Right?
Yeah.
So there's another paper that I wrote about that. And I found that it did not affect it did not significantly affect the relationship with the non-abusive parent. Yeah.
I'm surprised at that too.
Yeah, and I interpreted it as there are so many stories inside of this group. Some may have attached relationship with their fathers because their mother has been abusive, or they may have very detached relationship with their dad because they didn't do anything. For example, these are stories, mixed stories. Yeah, so maybe part of it is related to. So that's why I looked at the relationship with the perpetrating parent. Yeah. Okay. Yes.
Does certain questions account for the fact that both parents can be abusive?
For the first paper,
Either of them.
so the second paper, it was simply your parents did this to you. The first paper, both parents, and so in case they were abused by both parents, I include them in both models. If they were abused by mothers and they also abused by fathers, I include them in the caregivers of mother groups and also caregivers of fathers group.
Did you also analyze that group separately to see if they had any other differences beyond just like their relationship? Because I would imagine that children of parents where both parents are abusers should differ from a group where children of parents with only one abuser.
Yeah. I believe so, and I wasn't able to look at it because of the limited sample sizes, but yeah, I believe I don't know how to answer scientifically. I believe the intensity would have been higher, and so it may have.
Or frequency being higher since that's what it measures?
Yeah, I want to look at that, whether if they were abused by both parents, the intensity based on the Likert scale tend to be higher or not. So that's a great idea. Thank you. Yes, Nina.
For your first paper, you used
Uh-huh.
as a member of child students. Were there any other types of bullying?
So for the first paper, I used both verbal and physical abuse combined by mothers versus fathers. Yeah. Yeah. Okay. And in WLS has sexual abuse variable, but it was based on mothers specifically. And then there were very few samples who were sexually abused by, fathers specifically, and not including sexual abuse by mothers. And I could have included those, but they seem to be very different being sexually abused by fathers. And so I did not include that in the first paper. Any other questions? Yes, please. Yeah.
So you mentioned that childhood neglect is defined as if the parents isn't able to provide basic necessities to the kid. How is that different from just being poor?
How is it?
How is that different from just being how is that different from just being a low income person and therefore unable to provide for your
So
kid?
you're saying that could be related to poverty?
Yeah, how do we define childhood neglect?
Neglect. How do we define? It defines based on emotionally or physically, whether there was someone to take care of you or love you. That's one aspect of neglect. Another is more like a physical. Were you able to have good clothing? Did you have medicine? And so on. And so neglect, I think it was more related to the physical aspects. Did you provide? Were you unable to meet your kids' basic needs, nutrition, clothing, and healthcare in this context? Am I addressing your question? It's a little vague.
As in, it could be that I'm just poor and therefore I cannot provide
Uh-huh.
clothing for my kid.
Uh-huh.
So does that mean I'm going to be a neglectful parent then?
Yeah, it's very, this measure specific definition, it definitely has a limitation. Yes. Thank you for pointing that out. Okay. Oh, yes.
Questions that
Yeah.
I think this topic, and I'm just curious, what are some like policy implications of like whether it's good or bad for children to be living in three-generation households?
Yeah.
What would be some like policy implications related to?
Oh, I see. Since there are some protective effects, right? If these parents engage in less verbal aggression and they engage in less neglectful behavior, I would say it may improve the interaction. It means improve interaction with the kids, and then it may increase outcomes for kids. But I know many of you study policy and you go with the causation. You need to check the causation, right? And so our evidence is limited. I wanted to acknowledge that. The current limitation is limited but the one thing for sure is that these families need support. That can affect, even living with your abusive parent can reduce you engage in bad treating behavior towards your kids if you have additional support, financial support, and support with the parenting. I think it will be very influential for these families. So that's one thing I can say for sure. Okay. Oh, yeah.
I'm just wondering, for the second paper, do you have access to like the age of the parents, like of who they're living with?
The aging parents, the age of the aging parents.
Yeah.
I don't think we have that information. Do you think that will be an important, because whether they need caregiving support or not?
Also, I just think like maybe qualifying for Social Security and things like that, and having additional
Ah.
supports that might, I don't know, make it more viable to have like a three-generation home or something.
Yeah.
I'm just curious if that played any role.
Oh, that's something I haven't been able to think about, but yes, that's likely. Sounds likely to me. Yeah, but we don't have that information in the data sets. Yes.
I just have one last question on your second study.
Uh-huh.
Are you at all concerned that the domestic violence question is going to be
Yeah.
Like experiencing parental domestic violence? Because, for example,
Yeah.
one of the other key characteristics of physical abuse and within domestic violence is threats. of
Threats.
abuse,
Yeah.
which does not necessarily include an actual
In-
physical
Yeah.
altercation.
Yeah. So are you suspect that the percentage could be higher even because it's not inclusive of all these different behaviors?
Yeah, and especially
Yeah.
if you're trying to get at a retrospective view of
Yeah. Yeah.
current adults looking
Yeah.
back on their childhood.
Yep.
They might say, oh, because there was never this, very
Yeah.
specific visual
Yeah.
marker,
Yeah.
therefore it wasn't abuse. When
Yeah.
what you're trying to get at is how do these cycles of abuse occur,
Yeah.
whether or not the individual is like looking back on it and naming it as abuse.
Yeah, I can see both ways because in the items from the national surveys, they simply ask, did you witness domestic violence? It was much vague and simpler, and this question asked some specific behaviors. So maybe that's why it increased the percentage, or it also lowered the percentage compared to that. So I acknowledge the limitation. It was single measure. And so, yeah, but I wonder how it played out. Thank you.
I noticed that Catherine snuck out, so I will play my
Thank you.
associate director role and bring this to a formal close, but thank you very much.
Thank you so much.